Well, I think there's unfortunately an increase in measles in the last 4 or 5 years in the U.S. You know, the current outbreak now is probably in 12 states. Um, but as you are right to highlight that this measles has been around. I mean, in 2024 we had a significant number of cases. The problem is there's significant measles throughout Europe. Italy, a lot of the European countries have active measles transmission. So people that go on a vacation to Europe, they end up bringing back measles. And we do have some parts of our country that are just under vaccinated. The area that we're dealing with in Texas right now, only 82% of the community has been vaccinated. And normally with measles, we need to really be up about 93% before we actually see what we call herd immunity to block community transmission. So that's one of the reasons we're seeing a big outbreak in the in the Texas region right now. They're just a highly under-vaccinated population.
Yeah, very interesting, this context that you're providing with our viewers right now. Again, it doesn't have to do with who's in charge in Washington, D.C. It's those individual decisions about choosing not to get vaccinated. Here, you put yourself at additional risk. I wanted to ask you, Doctor, about who's been tapped by President Trump to lead the CDC this time around. As someone who's had that position for several years, what do you make of the decision here to nominate Dave Weldon? What will you be watching for during today's hearing?
You know, I've met with Dave. I've had lunch with him to try to share my experiences. He's an excellent physician, internal medicine, been practicing. He also has a legislative experience, having been in Congress for many years. So I know he has a long relationship with Robert Kennedy, which is also a positive thing for the CDC director to have a good relationship with the Secretary of Health. So, I'm here to support him. It's a complicated job. It's more complicated now post-COVID because a lot of credibility in the public health CDC and the public health community has been lost because of some of the, I think, mistakes in policy that were made during COVID, particularly the vaccine mandate, closing of the schools, the shutdowns of employment, shutting down churches. These were all non-thoughtful policies that I think have come back to cause a credibility problem. Dave's got a big job to try to rebuild that.
Yeah. You're just reminding me of some of the decisions that were made by, in some cases, local officials or state governors weighing in as well. But also we're taking these directives from federal officials, and it really did change, obviously, our lives back in 2020. You've sort of spoken out about this since 2021, believing that the virus was ready-made for humans and had come from that Wuhan lab. But that idea was something that many people initially had described as a conspiracy, and even for years following. Let's go back in time for just a bit.
President Trump is pushing a conspiracy theory again. That coronavirus began in a lab in China.
U.S. politicians are accusing the Wuhan lab of intentionally leaking the virus as a lie that's been fabricated for American political ambitions.
We don't need to invoke conspiracy theories. It's just basic biology.
Now, this particular claim that this virus was leaked from a Wuhan lab has been disputed by experts and scientists from around the world.
So that leads me to wonder, when there are other labs investigating different viruses around the world, perhaps advancing these viruses, is there transparency between what's happening there and the United States? Do our top scientists know what's going on in some of these labs overseas?
No, there's a lack of transparency. I think it's important. Senator Paul has a bill that he's trying to put forward that will require a lot of our science funding that we do around the world to also be evaluated for its national security implications. I think it's really important. Unfortunately, there's really only one credible hypothesis for where this virus came from 5 years later. 5 years ago, it could have been spillover, it could have been the lab, but the reality is all the data, it really supports that this came from a lab. And I think you'll see all the intelligence communities revise their analysis. Recently, the CIA did. So now you have FBI, Energy, and CIA all saying it came from the lab. I think you'll see the rest of the agencies follow suit. Very disappointing, large scientific evidence that this virus did not come from nature. This was an engineered virus. Now, I don't believe it was leaked intentionally. that was said in that report. But I do believe it was leaked out of the laboratory, and the laboratory was doing purposeful research where they intentionally were trying to teach this virus to be more infectious for humans.
Wow. That thought, by the way, that would have been considered misinformation or fake news only a few years ago if you were trying to express that on certain social media outlets.
Oh,
How
I know.
dangerous
I
is
know.
that censorship?
Well, it's serious. I mean, when I was on CNN and gave my professional opinion, I ended up with death threats. I ended up in the front page of the Baltimore Sun saying that I was an Asian racist. I ended up with the state of Maryland Senate and House passing resolutions that I was a racist just because I proposed a scientific hypothesis. So the censorship was heavy. The real conspiracy in this whole situation was the conspiracy to try to get the entire scientific community and the intelligence community to buy into this being a natural spillover event from the wet market. The epidemic really started in August, September. It didn't start in January, December, January. And so the proximal origin paper and those scientists that tried to write that paper that it came from the wet market, it's really not an accurate paper. It needs to be retracted. And it really was, in my view, a conspiracy to turn the attention away from the laboratory because certain people wanted to protect gain of function research at all cost.
Is withdrawing from the World Health Organization, the WHO, as we've seen President Trump allude to, is that the right decision?
I think it is. It's complicated. I had many people in the WHO from CDC. I had about 30 people that were deployed to it. I have a lot of respect for a number of the people at the WHO. The problem with WHO and the current international health regulation, it's not enforceable. As we saw with the issue of COVID, where I wanted to go in January, and Tedros and WHO wanted to go in January to help the Chinese deal with this pandemic, and we were not allowed to do that. So I do think there is a problem with WHO being a non-enforceable health organization and looking at it. And so I think, the United States has decided that it may not represent our national security interest at this time. And the challenge is going to be, what do we do in replace of it to try to meet our needs for global surveillance?
Clearly, you expressed a differing view or even hypothesis, in your words, during that time when we were trying to figure out the origins of COVID and really how dangerous it was. Did you feel as though you could freely express that among colleagues, including maybe most recognizable for us, Dr. Anthony Fauci?
Well, I could at the White House Task Force. I mean, I was very honest and open, transparent at the White House Task Force that was led by Vice President Pence. And in those meetings, I made it very clear what my professional opinion was as a virologist. Tony made clear his opinion that it was spillover as an immunologist. And we debated it in that room behind closed doors. We didn't do it in the public domain. Clearly, in the public domain, people like myself were ostracized because of our scientific opinion. I mean, Lancet had a letter, which I call a wedding announcement, where over 20 very prominent scientists signed a letter saying anybody who believed that the virus came from the lab was a conspirator. So no, there was an aggressive scientific conspiracy against people like myself that thought there really were two hypotheses that should be aggressively explored, and we were very disappointed. I mean, the whole approach was so antithetical to science. Science fosters debate. Science likes to prove each other wrong. That's the process. Here, it was a phone call February 1st that basically put certain scientists on the phone call. I was not part of that phone call. I don't quite understand why, since I was the director of CDC. And the scientific community came to a consensus that there was only one credible hypothesis, that was spillover. And it's just a very sad day for science.
Yeah, indeed. And you're right. There's no doubt been a lack of trust in some of our top experts in the field because of the public handling of the coronavirus. Now forward thinking, Dr. Redfield, is there something that you believe today is the biggest health risk for Americans?
Yeah, I think really, I've always said that the COVID pandemic was the lesser pandemic, and that I'm concerned of the great pandemic. And I am continuing to be concerned about that. I think bird flu has the potential to become the great pandemic. Right now, it's isolated between birds and mammals. It's gotten in now into 48 different mammal species in the United States, as you know, including dairy cows and obviously chickens and turkeys. We have over 100 million chicken and turkeys that are infected right now. We've had think about 70 human infections. The virus hasn't learned how to go human to human, similar to what we talked about with COVID. Originally, COVID didn't know how to go human to human either. It was taught how to do that in the laboratory. I always remind people about the COVID virus. It's kind of interesting that this virus that my friends like Dr. Fauci said came from spillover from bats, that virus no longer can infect bats. All right, it infects humans very efficiently. So I'm worried about bird flu. You're seeing it agriculturally right now, making an impact in the nation. If in fact bird flu learns how to go human to human, it will be catastrophic. I don't agree with my scientific colleagues that are intentionally taking bird flu into the laboratory and trying to teach it how to infect humans. I think that's misguided.
Is that happening?
Yeah, that's happening, yeah. I think it's misguided that we're doing gain-of-function research with bird flu.
Wow. And that's happening at U.S.-based labs?
Well, I know there were grants at U.S.-based labs to do it. Whether they're actually operational or not, I don't know, because last time I said that they were operational, and some people criticized me. But there is not a moratorium on gain-of-function research right now. And there are laboratories that are looking at bird flu. We know the exact 4 amino acids that have to change in order to make it highly transmissible for humans. It was published in 2012. I argued against its publication. I lost that debate. So I do think we should stop gain-of-function research, particularly with bird flu right now, but really in general. And I think we should get much more prepared. I'm a big advocate that we need to invest much more heavily in antiviral drug development. I remind people that we had one of the most successful vaccine programs in the history of the world with Operation Warp Speed. I was on the board, and we developed a number of vaccines in record time in 8 months, and yet still 1.2 million Americans died. So my answer to bird flu and as a problem is really not that we need more vaccines. I think we need aggressive antiviral drug development so we have a variety of options to treat people if and when they get infected.
Information. Truth is freedom. Is Newsmax. It's real news for real people.